Hi ladies, and welcome to Complete Midlife Wellness Center. I'm Dr. Susan, and I want to tell you a little bit about our annual wellness experience, because this is not what we're used to experiencing with our annual Well Woman exam. We recognize that wellness is much more than just a pap and a mammogram. You are a whole holistic person. So we're going to devote an hour of undivided attention to you, focusing on exactly what your needs are, what your goals are, and how we can co-collaborate as a team to help you to get there, to have the healthiest and happiest second half of life possible. We will be doing a pap smear and a mammogram, but so much more. So what to expect when you come into your first visit: we have a very small waiting room because you're not going to wait very long. Once you've sat down for a moment and signed a couple of forms, we'll whisk you back into our very comfortable office. The first thing that you'll do is get body composition with our in-body machine. Not just weight on the scale, that's really almost useless. We do not care what you weigh. We're really interested in watching how much muscle mass we have, especially as we get older. That's a critical piece of information that can help us to predict longevity and a lot of disease processes, and also look at how much body fat we have in relation to our total weight. And then we can set up some goals of how to establish that optimal body composition that we all want going forward. Also blood pressure, of course, which is critical and can predict a lot of diseases. After that, you'll go back into one of our really comfortable consultation offices, really more like a living room. You'll be sitting on a couch, kind of like you see here, talking to the provider for close to an hour as she gets to know you. We're asking so many questions about sexual wellness, about bladder function, about your hair, your skin, the perception of your weight, your relationships, your sleep, hormonal symptoms to do with menopause or perimenopause, vaginal dryness, lots of different things that can help us to understand what you need to feel better. Once we've gathered all that information, we'll move to the exam room. Yes, we do have that dreaded exam room with the stirrups and all the things, but we made it as nice as it could be. We use cloth gowns, not the yucky paper ones. We keep everything warm. We have nice, comfy, fun stirrup covers. That part of the exam takes about 5 minutes, so we will do a pelvic exam. We'll do a pap smear if necessary, look at the uterus if you have one, ovaries, bladder, rectum, vaginal muscle tone, all that important stuff. Breast exam, of course. We will order the appropriate tests like mammogram, bone density, colonoscopy, but we're also going to up-level that a little bit and talk about additional testing that we can do to look at your cardiorespiratory fitness, like a VO2 max, or to look at your cardiac health, coronary artery calcium score, for example, and other tests that are available to help us establish what your risks might be for some diseases that we don't want you ever to get. So we're looking at wellness way back here. We want to find any evidence that you might be likely to get a disease way before you get it and nip that in the bud. After you've become dressed again and come out of the exam room, we're going to go to our lovely lab area. We will draw your blood. We are testing an extensive panel looking not only deeply into your hormonal status, but also just general wellness, including some biomarkers that look for risk of heart disease, insulin resistance, which is a precursor to diabetes, micronutrient status, iron status, lots of things to try to figure out what we need to do to become optimal, because we don't want to be normal. We want to be the best that we can be. Once we've drawn your blood, and we do recommend you come in fasting for this visit so we can get the best lab results, then you'll be escorted to the front desk. We'll make you an appointment for your second visit, which is another full hour focusing 100% on you, this time going over the results of everything that we've obtained from the first visit. So 2 full hours of focusing 100% on you, because you deserve it and you are important. And with that information, we can put together a plan together. We're not telling you what to do. We're making suggestions that work for you so that you can move towards the optimal version of you. Now, once we've done those 2 visits, we do recommend seeing you every 3 to 12 months, depending on your needs. If you decide to pursue menopausal hormone therapy or any other additional options, we need to follow up and see how that's working. So we're going to be working together as a team together as long as you will allow us to be part of your wellness experience. So we do hope to see you soon for your annual wellness experience. Give us a call at the number below, or you can email our appointment team, and we look forward to seeing you soon.